COVID-19 infections in the Philippines breached the 3,000 mark for the second consecutive day yesterday. That also marked a new 5-month high in fresh infections, spurring fears of a sustained surge. On top of that, occupancy rates in some major hospitals in the metro are on the rise once again, with some facilities reporting full occupancy in COVID isolation wings. The UP Octa Research team says localized lockdowns are clearly not working. Their advice to the public: act as if we're back in ECQ. The country is getting much-needed ammunition against these rising numbers with the arrival of more Astrazeneca shots today. And Pope Francis spoke to Iraq's top Shia Islam leader in a historic meet yesterday. Together, the religious leaders called for an end to violent sectarianism. Fast, focused, and fearless. Here's everything you need to know to jumpstart your Sunday. I'm Riza Diaz. The Health Department recorded over 3,000 new COVID-19 cases for the second day in a row yesterday. The DOH logged 3,439 new cases yesterday, bringing the total number of cases to about 591,000. Of these, over 43,000 are active cases. The death toll inched closer to 12,500 after 42 more patients died of the disease overnight. But 160 recoveries were recorded yesterday, bringing the total recovery over 5,000 or 535,000. The Octa Research Group says the COVID-19 situation in the metro is, quote, definitely not good. Professor Guido David of the Octa Research said that the 3,000 plus case count for 2 consecutive days means that the virus is spreading to more areas in the metro. David adds that some barangays that are seeing a slight increase in cases may soon experience a big surge in infections. He also warns that the emergence of the COVID-19 variants pose a significant threat and may affect hospital response.
As we know, the variant is a significant threat right now, and that could, we're not sure yet how that will change hospital care response to the variant, especially since we may not be that familiar with the variant yet.
David also reminds the public to strictly follow health protocols and treat the situation like we're back under enhanced community quarantine. This means that Filipinos should think twice when going out, especially in areas with high infections.
So let's be very, very careful when going out. Let's limit the time spent outdoors and not have to go out if it's not so necessary. So let's, in effect, let's limit the time spent outdoors for leisure activities and, restrict it to more to, work-related activities.
With cases on the rise, occupancy rates in some major hospitals in Metro Manila are picking up again. The Health Department reports that 8 hospitals in Metro Manila are now in critical occupancy levels, which means more than 85% of their COVID beds are now in use. Still, 115 facilities are still marked safe, meaning less than half of their COVID beds are currently occupied. But among those at critical occupancy levels, some are already reporting full capacity as of March 4. For one, the Hospital ng Makati has all 13 intensive care units and all 80 COVID isolation beds occupied. Meanwhile, the Hospital ng Muntinlupa and the Veterans Memorial Medical Center in Quezon City have fully utilized their isolation beds, although they still have ICU beds unoccupied. At the United Health Parañaque Hospital, all ICU beds are in use, but 1 isolation bed and 1 ward bed can still accommodate COVID-19 patients. The other hospitals reporting over 85% occupancy rates for COVID beds include the East Avenue Medical Center and Bernardino General Hospital 2 in Quezon City. The same goes for St. Clair's Medical Center in Makati and the Taguig Pateros District Hospital. Meanwhile, St. Luke's Medical Center denies reports that they are now at full COVID capacity. The medical group says they have noted an increase in admissions the past week, but noted that they still have unoccupied ICU and ward beds ready to admit new patients. St. Luke's urged the public to refrain from fear-mongering and spreading false information regarding hospital occupancy rates. Unverified rumors are spreading around social media purporting a full COVID capacity in St. Luke's Hospital as well as in UP-PGH. But as of March 4, PGH is still tagged at moderate risk, which means COVID occupancy in hospitals is still below the 70% critical level. 38,000 Astrazeneca doses will arrive in the country today in addition to the almost 500,000 shots that arrived last week. These are part of the COVAX facility's pledge to initially deliver some 525,000 doses to the country. Meanwhile, some cities in the metro have already begun their rollouts of the AstraZeneca vaccine yesterday. But should we wait until a more efficacious shot is available or go ahead and get vaccinated now? The World Health Organization answers these questions and more in this video. Let's watch this.
As new variants emerge, and as we learn more about how much protection the current batch of vaccines provide against them, people are wondering if they should wait till a more efficacious vaccine is available, or should they go ahead and get vaccinated now?
The good thing is there are lots of vaccines in development, but currently there are only a few that have completed clinical trials and that have had regulatory approval for use in countries. The good thing about all of these vaccines which have been approved is that they offer a lot of protection against severe disease, hospitalization, and death. And that's what we want. We want to reduce deaths. We want to prevent people from getting sick and going into hospital. We're still learning how effectively these vaccines protect against mild disease or asymptomatic infection. With the variants that are being described from different countries, people are asking these questions because there's some data coming showing that vaccines may be less effective in preventing against some of these variants. However, even in those countries, all of the vaccines that are approved still are very likely to protect against severe disease and hospitalization and death. So what's really important now is for people in countries who have been prioritized, who are in those risk groups, the health workers, the frontline workers, the elderly, and others who have been prioritized, must get their vaccines, because what we want is to prevent people from getting really ill or dying from COVID-19.
In some cities, serological studies have revealed that about half of the population has antibodies. Does this mean that these places, these cities, are approaching herd immunity? And should people relax the precautions in these places?
So WHO has been keeping track of these seroepidemiological studies, and at last count, there were almost 500. And if you take them all together, less than 10% of the world's population actually has antibodies to this virus. Of course, in some settings, like particularly in the very high-density urban settlements, there are pockets where 50-60% of the population has been exposed to the virus and has antibodies. But that doesn't mean that the whole city or the whole province or the state or the country is now achieving herd immunity. The same individuals who are living in that community, the moment they go outside to a place where there is less of herd immunity, and if they don't have antibodies, they will then become susceptible. The only way of achieving herd immunity at that scale is through vaccination, and that's what we're focusing on now through COVAX, to get vaccines out to all countries, to vaccinate populations as soon as possible. Till that happens, we need to continue to take all the precautions that we've been advised to and that we've been doing for all these months. And this is along with the government taking all the actions that they have been taking in order to keep transmission down as low as possible.
And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Pope Francis held a historic meeting with one of Iraq's most powerful leaders of Shia Islam, Grand Ayatollah al-Sistani, on his second day in the country. The meeting, a first for a Catholic pope and a Shia Islam leader, lasted for about 45 minutes at the Ayatollah's home in the holy city of Najaf. After the meeting, the pontiff called for religious communities to work together to end violence and sectarianism. The Grand Ayatollah likewise called on religious leaders to hold great powers to account and for wisdom and sense to prevail over war, and added that Christians should be able to live in peace like all Iraqis. Hundreds of protesters in Dawei, Myanmar were met with tear gas from the police as protests against the military coup intensify. At least one man was killed by police in Myanmar yesterday, bringing the total number of people killed since the coup to at least 55. Condemnation from international groups rained down on the military ahead of a United Nations Security Council meeting to discuss the crisis. Meanwhile, hundreds of mourners attended the funeral of a 25-year-old protester killed last Wednesday, the bloodiest day of anti-coup protests by far. Aka Moe's father said that the police shot his son right into his heart without humanity while the 25-year-old was trying to save a friend who also was shot. His funeral came as activists held more demonstrations in several towns and cities in Myanmar. Now, over in Paraguay, protesters clashed with police in the country's capital late on Friday as demonstrators show indignance over the government's handling of the coronavirus crisis. The riots turned the capital into a battlefield of fire, smoke, and gunshots amid growing outrage as hospitals are on the verge of collapse due to the pandemic. The protesters also called for the resignation of the country's health minister, Julio Mazzoleni. Reuters reports Paraguay logs 115 cases per 100,000 people daily. The data shows the country has vaccinated less than 0.1% of its population. Exiled Tibetan spiritual leader, the Dalai Lama, got the first dose of COVID-19 vaccine in Dharamsala, India. Dalai Lama was vaccinated with Astrazeneca's COVID Shield vaccine. After getting the first dose, he appealed to everyone eligible to get vaccinated as well in order to protect their health. And that's how the day is shaping up to be. Join us later at 10 in the morning as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.